So what do you think when you look at me? What do you think I do? What do you think I've done? I've been walking down the street with my beautiful wife, and multiple times someone's yelled, "Hey, Rasta! Rastafari!" Because of my hair, my dress, my swagger perhaps, and they're not complimenting me or notifying the people around us that I'm part of a political movement that rebels against the establishment. I mean, that's what Rastafari is. You know, they're rebelling. They're an uprising. They're calling out to me and notifying everyone that I'm a Rasta in the hopes that I have controlled substances on my person. No, I'm serious. No, and people walk up to me and they ask me if I have any because of the way I look. They don't know that I'm an alumni of the Graduate School of Statistics at the University of Minnesota. They don't know that I completed the full-time MBA program at the Carlson School of Management. They don't know that by trade I'm actually a healthcare economist that's analyzed millions of lives, that's predicted things you wouldn't think are possible to predict on billions of rows of data, thousands of columns. I've been doing that for the last 10 years. That's really who I am. I'm not a Rasta, so sometimes I find it as necessary to tell people, you know, who I am, because sometimes you look at something and the cover is very misleading, and that happens to me a lot. I'm Thompson Aderinkomi, and I'm the founder of RetraceHealth. Look at this picture. You all recognize it, and a story just immediately entered your mind. And you thought about the last time you saw this thing, and you either slowed down or you at least checked to see how fast you were going. There's a whole industry around slowing down driver speed at dangerous intersections and lengths of the freeway. And a couple nights ago, I did a little research, and I found 31 different scholarly articles full of statistics, which I love, and p-values, and this simple device, a radar laser screen that tells people how fast they're going, is the most cost-effective way to slow down motor speed. And I want to make the case today, one of my many cases that I'm going to try and make today in the time that's been allotted, that solutions to healthcare need to be simple. They need to be dead simple. If it takes more than a sentence and 20 seconds to describe why something's going to fix healthcare, then it's not going to work. I'm just going to say that, and I'll be happy to debate with anyone on that topic. If it needs to be simple first. Second, we need to define what does solving healthcare look like. We're talking about waste, we're talking about collaborations, we're talking about working together, we're talking about data, but let's all get on the same page on the definition of solving healthcare. And I'm going to define it for us in the context of my presentation, and that is lower prices. Not lower costs, not better value, not more data, not being able to make easier decisions. It's lower prices. And let's define solving healthcare by prices being lowered across the entire healthcare spectrum by at least 50%. At least 50%. Within a year of implementation of said solution. But what I want to focus on today is the price of healthcare, not the cost, the price. And waste, yes, waste in the system is a driver of increased prices, but I see Dr. Hernandez in the audience, and he's a family practice physician at one of the biggest primary care clinics in the cities. He knows lots of doctors. And I just don't think they're being wasteful. If you want to talk to any doctor, they're not going to say they're being wasteful. Same thing with consumers. We've heard that today already. They're not wasting anything. They're doing their best with what they have. And if we give them something better, then we're going to see reduced prices and reduced costs will follow. There's one thing that drives down prices. One and only one thing. And that is market forces. Market forces are the only thing that I know of that drives down prices. Reducing costs, supposing you actually can reduce costs. if you could. Supposing you could reduce costs, it will not drive down prices. And how do I know this? Well, I only have an undergraduate degree in economics, and I remember very little of it. But I know this much from my undergraduate studies in economics at the University of Minnesota. If reducing costs actually could lower prices, then from an economic perspective, we should expect that anything that has the same cost as another item should have the same price. If reducing costs is actually the way you lower prices. If this bottle of water costs the same thing as making this computer, then the two prices should be equal. And we all know that's not true. Only market forces can lower prices. And market forces are fueled by competition, in my opinion. Fueled by competition, and you could lower prices. And this is going to be the focus of the rest of my talk today. And my competition, and I want to argue as well, and I'll get into it more, that one of the main indicators that there is competition occurring in an industry is if the prices are going down. If prices are going down, you know there's competition. So the corollary of that must be that since prices are going up in the healthcare industry, there is actually no competition, by definition. Competition leads to price reduction, and then eventually you have a monopolist, and then there is no more competition and prices start to rise. So that's why competition, true, real competition, breeds lower prices. Now, I want to tell you a story. I got my hair done at a stylist in a salon, not a barber. And stylists know their clients very well. I was talking to my stylist, and she said, "Thompson, I know everybody. I know everything. I know what's going on. I know what's not going on. If I haven't seen you for 3 months, I know why I haven't seen you for 3 months. I know everything." One of my longtime customers came in one day with a long face. And I said, "What's wrong? Why the long face?" And she said, "Well, I make money, and I make $2 more than the Minnesota care requirement to be covered by Medicaid. $2 more. So I don't qualify." She's like, "Oh, that's okay. I mean, that's okay. You don't need that. There's other ways to get health coverage, health insurance." And she said, "Well, that's not actually the problem." The customer said, "The problem is, I just got diagnosed with colon cancer. I got diagnosed with colon cancer, and I don't have health insurance. And I don't qualify for Medicaid. And I don't have enough money to pay for the treatment out of pocket." So she does her hair, everything looks great. She walks out, and that was the last time my stylist saw that customer. In all her years of styling hair, she's never had anybody disappear. And it's been 7 years since she saw that customer. She doesn't know. What my stylist does know is that she always knows, and in this case she doesn't know what happened, but she knows that she talked to someone that was diagnosed with colon cancer, they couldn't afford it, they made just a little bit too much money to get on Medicaid, and in 7 years she hasn't been seen again. And I own a salon. I know how important women's hair is to them. So they just don't disappear to stop getting their hair done. This is why I'm so passionate about reducing the price of healthcare today, is to stop that from happening. If there was real competition happening, that woman would have had options to get her colon cancer treated. She would have disappeared for 7 years. I am an Apple fanboy, so all my products are Apple. And in 2007, Apple's iPhone was released to us so graciously by the late Steve Jobs. And the model with 8 gigabytes cost $499 in 2007. Fast forward to 2011. You have more than a 10x improvement in the iPhone's performance, and the price is $499 for that superior device from 2007 to 2011. If If you factor in inflation from 2007 to 2011, pull the CPI from the Bureau of Labor Statistics, you'll find that inflation, the increase in prices, was about 8.7% in that period. So actually, an iPhone with superior performance cost less than it did when it first came out. This is my goal, and the goal of other entrepreneurs for healthcare, is to make healthcare work like that, like the iPhone. Now, I did similar analysis, and no offense, I analyzed the free public data of Blue Cross Blue Shield, because they're the only health plan that publishes it in a very useful format. From 2007 to 2011, I looked at their financials. And I looked at their membership growth and their claims expense. And then I calculated the claims expense per member from 2007 to 2011, the same period that I just got done describing about the iPhone. Blue Cross's membership in that period decreased by about 7.9%. Its claims expense per member increased, adjusted for inflation, by 8.6%. An 8.6% increase in claims expense above and beyond inflation. That's expensive. Comes out to about $240 per member. If Blue Cross had the luxury of paying the claims prices that it had in 2007, in 2011, they would have spent $600 million less on claims. $600 million in total if 2007 prices were the same as 2011 prices. You extrapolate that to the other payers, and by payers now I mean health insurance companies, in the market, you're at least looking at $1 billion. $1 billion premium in 2011 compared to 2007. There's no indication of competition here. What we have is a fire. There's a fire burning. Fires need three things to burn. They need heat, they need oxygen, and it needs fuel. Very simple, very straightforward, very destructive, if not controlled. The prices of healthcare, at least from 2007 to 2011, compared to an iPhone, I would classify it as an out-of-control fire. A fire that has a mind of its own. And to put out a fire, there's only one thing you can do to put out a fire, is you take away its resources. You either take away the fuel, you take away the oxygen, or you take away the heat. The solution to put out a fire hasn't changed for decades, for centuries, thousands of years. You douse it with fire, or you douse it with water, and you scatter the fuel. The reason that works, bear with me, the reason it works to put out a fire with water is because the oxygen molecules in the water free the oxygen that's being used to fuel the fire. And then the water turns to steam, which carries away the heat. You only need to take away one thing to put out a fire, but water is so effective because it takes away two things simultaneously that are needed for the fire to stay alive and to do the damage that it's set on doing. And I want to encourage everyone in this room to think about the healthcare industry in this way. We have to solve it with simple problems, and those simple problems have to take away the resources. They have to take away the resources that are fueling that fire. And I'm going to tell you how we can do that together if we so choose to do so. If you can become an early investor in a startup's business model, please do so, because that is how you're going to put out the flame, the out-of-control flame of healthcare expense. With that, I'll close.